The chart fell from shaking hands to the sterile floor. Dr. Ryan Matthews stared down at the scattered papers, his first patient failing. Despite everything he tried, "Nothing's working," he whispered to the empty hallway. The harsh hospital lights buzzed overhead, casting long shadows across his exhausted face. At 26, fresh out of residency, Ryan had believed medicine was about finding the right diagnosis, prescribing the correct treatment, watching patients recover. His white coat still looked pristine. He'd been at Riverside General Hospital in Ohio for only 3 months. The patient in room 314 was dying, and Ryan couldn't figure out why. He bent down to collect the scattered medical records, his hands still trembling. Every test came back normal. Every medication he'd prescribed had failed. Bethany Sullivan, a 28-year-old teacher, was wasting away before his eyes, and modern medicine seemed powerless to help her. Dr. Matthews? Ryan looked up to find Nurse Jade Harrison standing in the doorway. She was in her early 30s, with kind eyes and graying hair pulled back in a practical bun. Her scrubs were the faded blue of someone who'd worked too many double shifts, but her voice carried the steady calm of experience. "You've been staring at those charts for 2 hours," Jade said gently. "Maybe it's time to actually talk to the patient." Ryan clutched the papers tighter. "I've examined her every day for 3 weeks. Her symptoms don't match any textbook diagnosis. The lab results are contradictory. I consulted with specialists in 3 different states." Jade stepped closer, ignoring his defensive tone. "And what has Miss Sullivan told you about how she's feeling?" "She says she's tired all the time. No appetite. Difficulty sleeping. Classic depression symptoms, but antidepressants aren't helping. Neither are the sleep aids or the appetite stimulants." Ryan's voice cracked with frustration. "I've tried everything. Have you asked her why she's depressed?" Ryan stared at her blankly. "Does it matter? Depression is a chemical imbalance. You treat it with medication." Jade's expression softened with something that looked like pity. "Dr. Matthews, can I tell you something about Bethany Sullivan that's not in her medical chart?" Before Ryan could respond, Jade was walking toward room 314. Reluctantly, he followed. Through the doorway, Ryan could see his patient lying motionless in bed, staring out the window. Bethany had been beautiful once. You could see it in the bone structure of her face, the way her auburn hair caught the afternoon light. But 3 weeks of medical failure had left her gaunt and hollow-eyed. "Miss Sullivan?" Jade knocked softly on the doorframe. "Dr. Matthews would like to visit with you for a few minutes." Bethany turned toward them, and Ryan was struck by how empty her eyes looked. Not just tired, completely devoid of hope. "More tests?" Bethany asked in a voice barely above a whisper. "No tests," Jade said, pulling up a chair beside the bed. "Dr. Matthews just wants to get to know you better." Ryan remained standing awkwardly by the door, unsure how to proceed. In medical school, they'd taught him to maintain professional distance, to focus on symptoms rather than stories. "Bethany teaches 3rd grade at Lincoln Elementary," Jade said, filling the silence. "Been there for 6 years. Tell Dr. Matthews about your classroom, honey." A flicker of something crossed Bethany's face. 26 kids this year. They made me a get well card." She pointed to a construction paper card covered in crayon drawings taped to the wall. "Said they miss me." Ryan glanced at the card, then back at his patient. "That's nice, but let's focus on your symptoms." "Dr. Matthews," Jade interrupted gently, "why don't you sit down?" Reluctantly, Ryan took the visitor's chair. This close to Bethany, he could see details he'd missed during his clinical examinations. The way she clutched a small photograph in her hand. The wedding ring she still wore despite being admitted as a single patient. "Tell me about the picture," Ryan found himself saying. Bethany's grip tightened on the photograph. "My husband, Michael, and our daughter, Lucy." Her voice broke. She was 4. Ryan felt something cold settle in his stomach. Was car accident 8 months ago. Tears began streaming down Bethany's face. Michael was driving Lucy to her dance class. A drunk driver ran a red light. The room fell silent, except for the steady beeping of monitors. Ryan stared at his patient, his mind racing. This wasn't in her medical history. How had he missed something so fundamental? I haven't been able to sleep through the night since, Bethany continued. Can't eat without feeling sick. Lost 30 pounds. The school gave me compassionate leave, but I can't concentrate enough to go back to work. Ryan looked down at his hands, feeling foolish. I'm sorry. I should have asked. You prescribed sleeping pills, Bethany said quietly, antidepressants, anxiety medication. But nothing stops the dreams. Nothing stops the guilt. Guilt? Ryan leaned forward. I was supposed to take Lucy to dance class that day, but I had a migraine, so Michael offered to go. If I had just pushed through the headache, if I had been the one driving, her voice dissolved into sobs. Jade reached over and took Bethany's hand. Honey, you know that's not your fault. My brain knows that, Bethany whispered, but my heart doesn't believe it. Ryan sat in stunned silence, watching his patient cry. Every medical textbook he'd studied, every lecture he'd attended, had taught him to treat symptoms with medication. But sitting here, seeing Bethany's raw grief, he realized he'd been trying to medicate a broken heart with pills designed for brain chemistry. The medications aren't working because grief isn't a disease, he said slowly, the understanding dawning on him. Bethany looked up at him through her tears. What? I've been treating you like you have a medical condition. But you're not sick, you're heartbroken. There's a difference. Over the next hour, Ryan listened as Bethany shared memories of her family. How Michael used to make pancakes shaped like animals every Sunday morning. How Lucy insisted on wearing her tutu to the grocery store. How their house still smelled like Lucy's bubble bath. And Bethany couldn't bring herself to wash the dishes from their last dinner together. For the first time since becoming a doctor, Ryan set aside his prescription pad and simply listened. I keep thinking about what Michael would want me to do, Bethany said. He used to say that giving up wasn't in my vocabulary, but I don't know how to live in a world without them. What do you think he would tell you right now? Ryan asked. Bethany was quiet for a long moment. He'd probably say I was being stubborn, that I was so focused on what I lost, I couldn't see what I still had. What do you still have? Those 26 kids at school, they need their teacher back. And Michael's parents, they've been calling every day, but I haven't been returning their calls. They lost their son and granddaughter too, but they're still trying to take care of me. Jade squeezed Bethany's hand. Sounds like you have people who love you. I've been so angry, Bethany admitted. At the drunk driver, at God, at Michael for offering to drive that day, but mostly at myself for surviving when they didn't. Ryan felt his throat tighten. Survivor's guilt is real, but punishing yourself won't bring them back. I know that. Logically, I know that. But how do you choose to keep living when living hurts so much? The question hung in the air, and Ryan realized he didn't have a medical answer. There was no prescription for this kind of pain. Maybe, he said carefully, you don't choose to stop hurting. Maybe you choose to hurt for a reason. Bethany looked at him with curiosity, for the first time since he'd been treating her. Michael and Lucy can't hug their grandparents anymore, Ryan continued. But you can. They can't teach those kids at school, but you can. Maybe living isn't about stopping the pain. Maybe it's about making the pain mean something. Over the following days, Ryan found himself spending more time in room 314, not as a doctor prescribing medications, but as a human being listening to another human being's story. He learned that Bethany had started teaching because Michael believed she had a gift for helping children feel safe and valued. He learned that Lucy had wanted to be a teacher, just like Mommy when she grew up. Jade, who had been a nurse for 15 years, watched this transformation with knowing eyes. One evening, she pulled Ryan aside. You're learning something important, she said. That I don't know anything about actual medicine? Ryan asked bitterly. I couldn't diagnose grief. What kind of doctor does that make me? The kind who cares more about healing people than impressing colleagues. Jade replied. Do you know how many doctors I've worked with who could recite every drug interaction, but couldn't comfort a crying patient? She handed him Bethany's latest lab results. For the first time in weeks, her numbers were improving. Not because of medication, but because she started eating again, sleeping a few hours at night, even calling her in-laws. How did you know? Ryan asked. That this wasn't a medical problem? Jade smiled sadly. Because I recognized the look in her eyes. I lost my husband in Iraq 7 years ago. No medication in the world could fix that kind of broken. Only time, love, and purpose could do that. Ryan stared at her in surprise. I had no idea. That's because you never asked. Just like you never asked Bethany what was really wrong until 3 weeks into her treatment. The next morning, Ryan entered room 314 to find Bethany sitting up in bed, brushing her hair. It was the first time he'd seen her out of the fetal position. Dr. Matthews, she said, I've been thinking about what you said, about making the pain mean something. And I want to go back to school. Not right away. I'm not ready for that yet. But I want to try. Those kids need their teacher, and maybe I need them too. Ryan felt his eyes well up with tears. I think that's exactly what Michael would want. There's something else, Bethany said. I want to start a foundation. Something to help families dealing with sudden loss. Michael was always saying we should do more to help people. And Lucy loved helping others. Maybe this is how I keep them alive. Over the next week, Ryan worked with Bethany not on medication schedules, but on planning. They researched grief counseling programs. They contacted Michael's parents, who were overjoyed to hear from her and eager to help with the foundation. They even arranged for some of Bethany's students to visit, which proved more therapeutic than any antidepressant. On the day of Bethany's discharge, Ryan found himself reluctant to say goodbye. This patient had taught him more about healing than his entire medical education. Dr. Matthews, Bethany said as she gathered her belongings, I need to ask you something. Why did you stop trying to fix me with pills and start listening to me instead? Ryan thought about it carefully. Because I realize that some kind of pain aren't meant to be medicated away. They're meant to be transformed into something meaningful. And you learned that how? From a very wise nurse who reminded me that being a doctor means treating people, not just treating symptoms. 6 months later, Ryan received an invitation to launch the Michael and Lucy Memorial Foundation, dedicated to providing immediate support and counseling to families affected by sudden loss. Bethany had not only returned to teaching, but had become an advocate for grief education in schools. At the foundation launch, Ryan watched as Bethany spoke to a room full of people who had experienced similar losses. She was still sad. He could see it in her eyes, but she was no longer hollow. The pain was still there, but it had purpose now. Dr. Matthews, she said during the reception, I want to thank you for the most important prescription you ever gave me. I don't remember writing you any prescriptions that worked, Ryan said with a smile. You prescribed me hope, Bethany replied. Not the kind that comes in a pill bottle, but the kind that comes from believing life still has meaning, even after loss. Later that evening, Jade found Ryan standing outside the hospital, looking up at the stars. Proud of your patient? She asked. Proud of what she taught me? Ryan corrected. I became a doctor because I wanted to save people. But Bethany showed me that sometimes saving people means helping them save themselves. And how do you do that? Ryan smiled, remembering the scared, hollow-eyed woman who had transformed into a beacon of hope for others facing similar darkness. You give them something no medication can provide, he said. You give them a reason to believe that their pain can become someone else's healing, that their story doesn't end with tragedy but begins with purpose. From that day forward, Ryan approached medicine differently. He still used medications when they were needed, but he never forgot that the most powerful healing often happened not through prescriptions, but through presence, listening, and helping people find reasons to hope again. And in the small town of Riverside, Ohio, the story of a young doctor who learned to prescribe hope became a reminder that sometimes the best medicine isn't found in a pharmacy. It's found in the connections between human hearts that refuse to give up on each other.